combating nutrition disinformation and general bull. It's Jimmy Rants. JimmyRants.com.
What's up, you guys? Welcome back to another Instagram Live, and we have a Jimmy Rants for you guys here today. That is one that is sorely needed right now, and one that I just simply cannot believe is being allowed to be put out there. You'll find out here in just a minute what I'm talking about. So welcome in, welcome in. If you're just joining us, you're watching Jimmy Rants. This is my brand new show I've been doing for a few weeks now, where I go on a rant about various topics. I start off on Instagram Live, so if you're not following me on Instagram Live, go to @LivinLowCarbMan, LivinLowCarbman, and you can watch these live along with all those beautiful people down there talking to me right now. And then you can watch the replay for up to 24 hours on Instagram. Then we hop over to YouTube and we house them where you can watch them on demand pretty much anytime you want to. And the all-new Jimmy Rants podcast, which if you haven't listened yet, go check it out. They're on Apple Podcast and getting assimilated in all the podcasting formats. It's a daily show, and I've got a producer that puts a nice little music bed behind the rant, so it's very entertaining to listen to, and it kind of distills down the best of the best information from this here show. JimmyRants.com is the website. So today's topic of the Jimmy Rants is a big one, guys. So those of you who are here live with me, I'm so glad you're here, because I cannot wait to interact with you about this one. The brand new 2018 American College of Cardiology, ACC, and American Heart Association, AHA, cholesterol guidelines have arrived. So I recently did a Jimmy Rants all about cholesterol and what matters most on your panel, and we determined at that time it was the triglyceride to HDL ratio that matters the most on your cholesterol panel, and not so much the LDL and the total cholesterol. So the brand new guidelines have just come out. I've got them right here in my hands, and I'm going to go over some of the highlights of this. Now, they update these guidelines just about every 5 years. So the last time they had them out was in 2013, and they've made some changes. So this, by the way, is published in the Journal of the American College of Cardiology and in the journal called Circulation. And so what they're trying to do is continue to put high cholesterol on the radar screen of people, especially doctors, when they're treating their patients, because they still view high cholesterol as a major problem in health. Okay, so they talk about over the past 5 years, we've learned so many new treatment options about lowering cholesterol, and the patients may benefit from them. And so we're going to help provide a treatment roadmap for clinicians to give them the tools to help their patients, yada, yada, yada. Okay, all of this stuff sets it up for what the changes are, and get ready to have your mind blown, you guys, because there's some decently good stuff in here, and there's a whole lot of crap in here, which I'm going to tell you about. So the new guidelines, in addition to looking at smoking, high blood pressure, and high blood sugar as risk factors in why your cholesterol is elevated, the new guideline also throws in family history, ethnicity, as well as health conditions like metabolic syndrome, chronic kidney disease, chronic inflammatory disease, premature menopause or preeclampsia, as well as high lipid biomarkers. All right, so that's not really a whole lot different than what doctors have been doing. They kind of generally look at the totality of the patient, and all of those kinds of factors go into it, but they've codified it now into the new cholesterol guidelines. What is interesting, though, is used to, whenever someone came in with certain levels of cholesterol, the first treatment option was always, always, always put them on a statin medication. So the good news in this whole report, you're about to get it. I hope you listen to this one carefully, because This is the only good part of these new guidelines. Rather than recommending a statin medication first, if the patient comes back with high cholesterol, which we've talked about this before, generally if you have a total cholesterol over 200 or an LDL cholesterol, LDL-C, over 100, that's what has kind of triggered going into statin mode, okay? So now what they're saying is we're recommending that doctors say to their patients to get a coronary artery calcium score. So you've heard me talk about getting a CT heart scan of your chest to see if there's actual calcified plaque going on. And so this CT heart scan, heart calcium score, they're now saying should be the next step after a patient comes in with higher cholesterol. I've been talking about that in Cholesterol Clarity like in 2013 when I released that book, about the last time these guidelines came out. I made that very suggestion that before we start putting people on a statin medication, we really should see if they have signs of disease going on. And if they don't have actual signs of disease, in other words, calcified plaque in the arteries, then why are we putting them on any medications at all? So at least they're now acknowledging something I've been talking about for about 5 years now. Let's get people to do a heart calcium score. So if you're listening to this, watching this right now, and you've never had a CT heart scan, go ask your doctor if you can have one run. If you eat keto, it should generally be 0. If you came into keto relatively unhealthy and already had some signs of metabolic damage going on, it could be out of whack. I've had 2 CT heart scans in the last 10 years, and they both came back a big fat 0, which is perfect. So that's what they say as the first modality. The patient comes in with higher cholesterol, get a CT heart scan, and then they say to help determine whether or not to use statins. Here's my concern. Let's say you go see your doctor. You've got a 270 total cholesterol, which forever and ever, amen, they've been using that number as the marker for prescribing statins, okay? So instead of going right to the statin, you go get this CT heart scan, and it comes back with 0. Do you think that same doctor is gonna go, okay, you're off the hook? No! They're gonna say, you still need to take the statin drug because we know it will save your life from a heart attack and yada yada, which it does no such thing. And so all they're doing is adding an extra step, they're adding in an extra cost to the patient, and at the end of the day, they're gonna do the exact same thing they've always done. So don't be fooled by these new regulations that say, well, we're gonna have them go do a CT heart scan and we'll determine whether or not we do a statin. They're going to put you on a statin anyway. So then the question becomes, why did we even put in that extra step of the CT heart scan? Most doctors don't know what to do with that information, and they're simply going to prescribe a prescription drug for you based solely on your cholesterol levels. So I'm not convinced this is really going to do anything differently. Now, you're going to find out later on in this Jimmy Rants, they're actually moving the number when it comes to cholesterol numbers, and we'll get to that here in a minute. They also wanted to address children. So for the first time, you guys, they are saying that the new guidelines suggest that you have cholesterol screening for children as young as 2 years old. 2 years old, we're gonna test cholesterol levels? Really? Really? And then they say do a follow-up at 9, and then another one at 11, and then again at 17, and then again at 21. So by the time they're 21, they're no longer children. And because they don't have any evidence as to what a normal level of cholesterol is supposed to be in children, they're not giving a range by which you should try to track and have as a target. Hello? Why are we measuring levels of cholesterol in children, if there's no range that we know is normal, what are we testing for? What's the point? I don't get it. And yet that's what they're recommending. And they even note in the report, in the guidelines, because of a lack of sufficient evidence in young adults, we have no specific recommendations for that age group. But they said this: it is essential that they adhere to a healthy lifestyle and be aware of the risk of high cholesterol levels, get treatment as appropriate at all ages to reduce the lifetime risk of heart disease and stroke. What a bunch of bull crap. Seriously, let's go back to the beginning of the sentence. It is essential they adhere to a healthy lifestyle. Translation, it's essential that they eat a low-fat diet with lots of healthy whole grains and eat crap, basically tasting food. That's what they're saying to do. They're not acknowledging anything about what a healthy diet is. They're leaving it up to the individual. And of course, in our culture, healthy lifestyle has long been code for low-fat diet. Then they say to be aware of the risk of high cholesterol levels. There is no risk of high cholesterol levels. They need to stop it. They're propagandizing people into thinking that high cholesterol is a disease. It is not a disease. And then to get treatment as appropriate at all ages to reduce the risk of heart disease and stroke over the lifetime. So are we going to put kids on statin medications? Is that where they're going with this? They're certainly leaving it open to interpretation that way, even though we have no idea, as they said earlier, what recommendations of cholesterol levels are appropriate for kids. It's just silly that they would even put this in here, and yet they did. The American Heart Association president said, having high cholesterol at any age will increase your risk significantly of heart disease and stroke. That's why it's so important that even at a young age, people follow a heart-healthy lifestyle, low-fat diet, and understand and maintain healthy cholesterol levels. Cholesterol levels have little to do with your health. Can I just say it bluntly like that? And I'm so tired of this getting repeated by medical professionals that actually know better. They're perpetuating this continuing myth that high cholesterol is a disease. And if you learn nothing else from this Jimmy Rants, just know high cholesterol is not a disease. High inflammation is a disease. And there's no mention in here about testing for inflammation levels. There's nothing about what you can do to lower inflammation levels, which, oh yeah, by the way, restrict your carbohydrates, eat more real whole food-based fats, stay away from the vegetable oil-based fats, which are highly, highly inflammatory. They don't want you to know all that crap, but we're telling you about it here today. So here's the bugaboo, you guys. Here's the part that I just about lost my lunch, and I didn't even eat lunch. The guideline sets out very specific recommendations for clinicians to start discussing options with patients in a brand new, very high risk category who have an LDL-C above 70. So if you have an LDL-C above 70, and we've been talking about this for a long time, that they were going to be lowering the level of LDL that's considered healthy. The previous guidelines and the ones before that all said if it's under 100, you're okay. Well, guess what? That wasn't good enough. They're now going to move the bar down to 70. Now, let me remind you about this LDL-C number. LDL-C is a calculated, estimated number. It's not actually directly measured on your standard lipid panel. They directly measure everything else, but the LDL-C is calculated based on all of your other numbers through this thing called the Friedewald equation. So the Friedewald equation spits out your LDL-C and it gives you this number. So we're really going to predicate treatment of patients based on an estimated calculated number that they've now lowered from 100 to 70. This is ridiculous, you guys. I mean, like, to the nth degree ridiculous. And yet, this is what doctors are going to have to follow. When you go see your doctor and you have a LDL-C that's above 70, they're going to start talking the S word. They'll say, go run a CT heart scan, but then they'll come right back with the CT heart scan. You got a big fat 0, and they'll say, well, your LDL-C is outside the range of what's considered healthy, so we have to get that level down. And so that's my concern with this. Then finally, they talk about ways to lower LDL and total cholesterol that aren't statins, and they're talking about these PCSK9 inhibitors. This is the new one, you guys. So your doctor has heard all the patients complaining about statin medication, so they've got this PCSK9 inhibitor. I don't have a name brand for anything, but they actually include a value statement in the new guidelines that underscores the need for clinicians to try to use this lower cost version of lowering your cholesterol levels. Now remember, you don't want to lower your cholesterol levels. You would rather have high cholesterol than you would have low cholesterol. There are so many negative health implications to having low cholesterol that any doctor who's trying to put you on a statin or one of these PCSK9s, you gotta tell them no. You would rather try to do things naturally and do it the right way through nutrition. And yet, they're not going to hear that. They're going to hear, oh my gosh, I've got to follow these guidelines that came out in 2018 that tell me I got to get patients LDL-C under 70. I've got to get their total cholesterol, and they've got to lower that one at some point. Since they've lowered the LDL requirement, they're going to have to lower the 200 total cholesterol probably down to 170. Okay? So when they try to pull this on you, as I said in my previous Jimmy rants about cholesterol, you kind of have to play the game with them, but you are not forced to have to take a statin drug. You are not forced to eat a low-fat diet. You are not forced to take a PCSK9. You're not forced to do anything if you choose to eat a ketogenic diet. And we know that a ketogenic diet does two things very good on your cholesterol panel that these new guidelines don't even address. Did you notice that? Nowhere in there did they say that you want to get your HDL higher. Nowhere. Because they know the way you get HDL higher is you eat more fat, and they don't want you doing that. There's nowhere in there about triglycerides being under 100. Nothing. Nothing about triglycerides. How do you have a blood fat like triglycerides, which we know is at the heart of most disease? Because it's related to your inflammation levels. If your inflammation's down, your triglycerides are down. If your inflammation is up, your triglycerides are up. And it's this key blood fat that in these 2018 cholesterol guidelines from the American College of Cardiology and the American Heart Association, the wizards of smart that are supposed to know about this stuff, they don't even mention triglycerides. I'm sorry, guys. This is propaganda. That's all you can say about it. It's propaganda to the highest level, and people are going to fall for it. And sadly, so many doctors are going to fall for it. Your primary care physician is going to fall for it because they're going to look at these guidelines and say, well, my hands are tied. I have to follow. Well, it's the American Heart Association. It's the American College of Cardiology. They know what they're talking about. And you would think your doctor would say, whoa, 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 whoa. But they don't. Some will. Some will get creative to get around it. But others will just go along to get along. And who gets caught in the crossfire of that? You, and you, and you, and me. All of us as patients do. Don't take it. Don't allow them to steal control of your health. And if they're going to come up with these cockamamie guidelines, which I describe down there in the description as dead on arrival, they're going to have a revolt on their hands. And doctors are going to have to play ball, especially all of us who go to them now as ketogenic dieters, and we're finding that our triglyceride to HDL ratio is getting better. And we come in with a CT heart scan that is a big fat 0. We come in with small dense LDL particles that are way down. All of these things that are signs of really good health, are they going to be able to ignore it simply because the guidelines that they have set for us say that we have to have an LDL-C under 70? Or that kids need to be on statin medications, or need to try to deal with their diet in some way, low-fat diet? This just makes me mad. And I hope that you get from this Jimmy Rants today that this is not the end of the story when it comes to cholesterol. But you have to be aware, guys, that this is the kind of stuff that's going on behind the scenes with cholesterol that your doctor is having to put up with and having to deal with. And a lot of them are ill-equipped as to what to do when they see a patient like you coming in that has a high cholesterol level and yet really good cardiometabolic markers across the board. Your blood sugar, your blood pressure, your HSCRP for your inflammation, triglyceride to HDL ratio, stellar. And yet if he sees total cholesterol and LDL cholesterol even a little bit out of whack, because of these new guidelines, he's going to have to play ball with pushing drugs and other therapies on you that you probably don't want to do. So that's it for this Jimmy Rants. Let's see what you guys have to say. I got fired up here today on this one. All right, any comments about this? Thanks for the good news about CT heart scan to find plaque instead of putting statins first. Yeah, K Denard 1, I'm really happy they put that in there, but I still contend that they don't know what to do with that information, doctors. So what will they do? Okay, you had a 250 total cholesterol, you come back with a big fat 0 heart calcium score. What are they gonna do? They're still gonna recommend statin medication. So what was the point, right? Welcome in, welcome in. Yes, grandma does keto, 24 months old. Yes, they want to put kids that are just 24 months old, they want to test their cholesterol. It's unbelievable. They are testing to see how much money they can make. Olga, you're getting at the heart of it, sweetheart. That's for sure. That's for sure. They're lowering the standard. And I've been talking about this since I wrote my book, Cholesterol Clarity, 5 years ago, and it came out. They've been talking about wanting to lower that level because people were obediently lowering their cholesterol and they were getting it in the quote range. Uh-oh, we've got to lower it a little more so they can have to go on medication and lower it some more with even more. So you're nailing it. Kat says, I was just thinking how average toddlers eat very low-fat diet, but it's crucial for their development. Mine eat a ton and all varieties. And sadly, yes, a lot of them are. And all this new cholesterol guidelines is going to do is just further that image that they should be eating lower and lower and lower fat. And what's going to happen? More and more and more disease. Keto Neogenesis Beth says they can test Maria Emmerich's kids and assume they have excellent cholesterol reading. Yeah, those kids are very healthy. I bet kids need more cholesterol than adults like older people. Yeah, Kat, they do. Especially as they're developing, that brain development so needs cholesterol. How do they do that? It's a risk at any age if they have no data. This is a circular argument. Grandma does keto, welcome to my world. That's why I wanted to do this rant today, because the fact that they want to do this kind of thing even on kids is just disgusting. When they find a way to patent butter, they'll suggest increasing good fat in your diet for lowering triglycerides, and you'll have to get like a prescription for Kerrygold. No, because then it would go 10 times higher in price, and I don't want to spend $40 a block for Kerrygold butter. All right, welcome in, guys. Ashton says, we as patients have to be our own best health advocate. You're preaching my language, Ashton. You know that that's definitely what I believe. San Ketonio Mama, sweet Lord. Yeah, isn't it something? We will outlive our doctors, Bullock. Bullock in 2018 says. Yeah. And I'm sad for doctors because they're some of the most intelligent people in the entire world, and they go into medicine to try to help people, and yet the very recommendations that they make are not helping people at all. I would argue they're harming people. And so they don't see it that way because they're having to follow guidelines. It's a really tough road, you guys. I could not imagine trying to be a medical doctor dealing with all the intricacies and the ins and outs of what they can say and can't say and can't do and can do and should do and would do. It's just, no thank you. I would not take MD after my name for nothing right now. Oh, my cousin Robbie's here. Hello, Robert Pardue. Backed off of the statin medications and I feel better. And you do feel better because your body isn't in a statin deficiency, Robbie. It's in a I need good nutrition deficiency. And so, and here's the thing, Robbie. I talked about you the other day of your triglycerides being very, very high. A statin drug does not lower your triglyceride levels. And so you had extremely high triglyceride levels, and yet they put you on a medication that does nothing for triglyceride levels. And in these new guidelines, they say nothing about triglyceride levels. The best way to lower triglycerides is to cut your carbs. That's it. That's how you lower trigs. And yet, how many doctors are telling their patients that have high triglycerides that they need to cut their carbohydrates? No. They're telling them, eat more healthy whole grains, cut your fat, exercise, and here, take this medication just in case. That's not good enough anymore. That is so bogus, and people are getting sicker and dying sooner because of that bad advice. You said statins inhibit CoQ10, which your heart needs, right? Yes, Olga, exactly. I did a whole rant about this one before, so definitely go back and watch the Jimmy rants that I did all about cholesterol previously, but I wanted to talk about these new guidelines here today. But yes, statin medications, one of the things that they do is they lower CoQ10, which is an essential heart health element. You lower CoQ10, you're at higher risk for having a heart attack. And yet no doctor's telling you about that either. Ugh! All right, guys, I'm out of here with this Jimmy Rants here today. JimmyRants.com is the website as always. And head on over to JimmyRants.com, and then you can click on following me here on Instagram at Living a Low Carb Man. You can watch it for 24 hours. If you don't watch live, you can watch the replay for 24 hours. Then hop on over to YouTube. You can watch the replay on demand there. And then the all-new Jimmy Rants podcast, now available on iTunes, wherever you listen to podcasts. It should be by now. And yeah, we love doing this. And today I had to get on here. I had to get on here and rant about these new guidelines. Please spread the message to other people that are probably unaware about the new guidelines. Tell them this is what they're going to expect when they go see their doctor. And if you can get on keto sooner than later, it's going to make you a whole lot healthier so that you don't go down the rabbit hole of following these new guidelines that will make you sicker and possibly die sooner. I hate to say it that way, but that's what's going to happen. People are going to get even more sick than they are now, and it's going to be because of these guidelines. And yes, I will calm down, Bullock, in 2018. I'm healthy, so I can keep my cool and yeah. All right, guys, that's it for this one. We'll see you next time. Bye.